Sabotage. There are so many things that get in the way of patience. Stress is a big thing to overcome, but the other thing is sabotage, both from other people when you begin to lose weight, and then also self-sabotage. And so what we want to do is we want to overcome those reasons. Because what happens is everybody likes certainty. The friends want you to stay like you are. And some of them are thinner, so they feel better around you when you're heavier. So you start losing weight, and then they get insecure. And so they start getting upset. They tell you you're getting too skinny. Oh, you're getting gaunt. And I hear that every day from my patients where someone's trying to sabotage them to get them to eat, telling them how bad they look. Oh, you look too skinny. And then I can look at them and go, well, I don't think so, because when we look, you're still 20 pounds overweight. And they got to learn those things, so I can help them get over that insecurity. The other thing is I see spouses and boyfriends do that a lot, where they say, you need to stop going and losing weight. You need to get off the meds. And the reason is, as a group, us men are insecure. We tend to feel bad about ourselves. If our wife was bigger, we're pretty secure. We feel that she's not going to stray. But then when she starts losing weight, she starts getting attention again, and we start feeling bad about ourselves, because usually by then we have a 40-inch belly. We don't feel good about ourselves. And so you see a lot of marital conflict in people that lose weight. One other sabotage, besides having your friends and co-workers and husbands sabotaging you by trying to get you to slow up your weight loss, is self-sabotage. So many people hide behind their weight. It tends to keep them from having to perform as much. So as they lose weight now, there's a lot more pressure to stay looking good. There's pressure to move faster, to do different things. And a lot of people that have been harmed even as children, as they were harmed, it tended to keep men away. It kept other people away. And so now they're being asked out more. And so you got to start developing confidence that you're okay, that your life is going to be much better. There's two forces in humans that dictate what you do for behavior. One is avoiding pain, and the other is seeking pleasure. So what I tend to do is I have patients start looking at their goals again and seeing, what did they accomplish? How good do you feel when people say how good you look? It's got to feel great. And then looking at the energy and what do you gain by continuing to do what you do, versus what do you lose if you go back to where you were? And I lay it on them because I want to stab them, because if they could feel the pain, they'll stay on track. And so that's a big part of what I do, is basically trying to keep people motivated, because that is probably the biggest key to getting to your goal, is staying motivated. I wanted to talk for a brief instant about childhood obesity. And when you have kids, the cool thing about them that is different from us adults, we're as tall as we're going to get, we're not getting taller. But if you take a child that's 5'2", 170 pounds, he's grossly overweight, he's obese. But when he's 5'7", he's normal. And so we just got to get them to grow those 5 inches without gaining 20, 30 pounds. What I learned is most children grow 20 pounds every inch they grow. But when they come to me or they go see their physician and embark on a program, that next inch they might maintain and stay the same. And what that does, most children won't want to go swimming. They don't want to go swimming because they have a belly or they have breast tissue. And so they won't take their shirt off when they go swimming. But if they start stretching higher, it's like an illusion, or it's like Stretch Armstrong, where their abdomen starts shrinking in and they start developing confidence, and they can go swimming again. It's outstanding. It's one of the greatest parts of my practice, is treating young people and seeing how they start blossoming and talking. I had one girl, in fact, she came to me, she was 201 pounds, and her mother was 120. And her mother brought her to me, and she was a junior in high school, never went on a date, and she came to me and she said, next year I want to go to prom. And her mother got down to 100 because she was about 5 foot and this girl was 5'1". Her mother got down to 100 in about 4 months and stopped, but the daughter got into it and she started coming, and she lost, out of 26 visits, she probably lost 25 times. She ended up, when she went to prom, a boy asked her, she weighed 120 pounds. I was so lucky to be able to participate in her care like that and be part of that.